mass, we now take up the last chapter which we cover now, which will be the second chapter of your civics books. Open your civics books to the civics section to the second chapter, which is your third and final chapter for this term. Okay, and the name of the chapter is, just a second, I'm not able to open. Yes, the role of the government in health. Can you see the chapter? Here is the chapter, role of the government in health. That means what role does the government play for the insurance of proper health and care in the country? Okay. Health care is an aspect that has been neglected in India. It needs to be taken up on a war footing. The Constitution of India advocates that the state shall endeavor to raise the level of nutrition and standard of living and to improve public health, but it is hardly available to the poor. The section discusses how the disadvantaged faces immense problems in keeping good health. Every citizen has a right to the basic amenities needed to keep good health. Good health comprises physical, mental, and spiritual well being. So now they tell you very clearly that it is the prime duty of the government to look after the health of every individual. Healthcare facilities should be given to one and all. And this not only does the government look after, but is also mentioned very clearly in the Constitution. Now, I repeat, what is Constitution? It is a written set of laws which a particular country follows. So, in the Constitution of India, also, it has been very clearly written that the health of every living being should be maintained, the standard of living should be improved, and there should be a disease free, a free nation with no disease or any health issue. But then comes the problem, the poor, the lower section of the people, they are deprived of it. And so, for that, the government takes up all the issues, all the proper health facilities are taken up so that the physical, mental, and spiritual health is looked after. Now, you all know it very clearly that bathrooms available, but have you seen the Shulabh Sauchalayas, which are built at every, a short distance, open toilets? I mean, a place where the toilets are built. Have you seen them? While you're
Yes,
crossing. Ah, so those are built for these people only so that the health and hygiene could be maintained. Why? Because the poor people who don't have proper living conditions. So how can you think of having a toilet in their houses? They live in small huts maybe, or they live in rags, or maybe they are sleeping in the pavements, etc. Such poor people, when they don't have even a house, how can we imagine of them having the proper sanitation? So for that, they have this facility which they built for public. Now, apart from this, have you heard about the campaign, the Pulse Polio, which even Amitabh Bachchan gives a proper, propaganda. He does propaganda that do boons zindagi ke. You remember? He gives where the polio vaccine is to be given to the children of less than 5 years. Now, all
yes,
these
ma'am.
campaigns, yes, so you are aware, that makes me happy. So, children, you all know that all these campaigns, those who can afford, they can easily go to the hospital and get it. But for those who are poor, it is the work of the government to look after. And they give all these vaccinations for free. Okay. So it is the prime motto of the government to look after the health of the people. Is this much first paragraph clear to each one?
Yes, ma'am.
Moving further, thank
Yes.
you. Thank you for responding. I really feel good when you respond back. The government has taken stringent steps through various public awareness programs to help keep surroundings clean. What is needed is to persuade the public to keep their surroundings clean and free from mosquitoes and flies because they spread diseases. We should not let water collect around our house. Use of boiled and filtered water is necessary. Individual cleanliness is very important. So again, they are highlighting about the cleanliness. They are telling that everyone should drink boiled water and leave the boiled water. We now have purifiers in our houses, and they ask us that we should keep our surroundings clean. And this is very obvious. This chapter is quite easy because we know most of the things. So not just the people who can afford such cleanliness, but also the poor people should be encouraged for these health, uh, you know, what do you call it, for health awareness. Okay, now they talk of one very important heading, which is called What is Health? Now, before we keep talking about health, let us know what health is. Health is directly associated with physical well being, remaining free from illness, and thereby not having to visit a doctor. So, now what is health? A good health is when you are physically, mentally, and emotionally free from all ailments. You are not visiting any doctor for any of the diseases, for any of the illnesses, and that state of health is known as a good health or a health which we all aspire for. Now, disease or an accident is not the only thing that could affect our body. We could be prone to illness if we do not get enough food. Cramped and unventilated living conditions may also be a reason to fall ill. Mental and physical strains can also cause grave illness. So, we should all strive to remain in good health by practicing clean habits. So now here they talk of children, another very prime aspect. They say that every kind of health, if we are disease free, if we don't have any sickness, that doesn't mean that we are free from all illness. A good health also needs good living condition. Supposing you are living in a damp area where there is a scarcity of fresh air to breathe. So in those situations, when you are deprived of any cleanliness, then it is resulting in mental and physical health. So any type of living condition which is not healthy is also looked after. For the latest, if you have seen the Ran Baseras, have you seen Ran Basera? The governments have opened the Ran Baseras. That means the night shelters for these cold weather, just to save the poor from dying in the cold. They have made small night shelters for these people where very good, very good. Please switch off your mics. So we stop here for today. We'll take up this chapter further in our next class. And there are two recordings which we'll have for this class. Okay, one dealing with the question answers and the other dealing with the new chapter, role of the government in health, the civics chapter. Okay, is this much clear to each one of you?
Yes,
Yes,
ma'am.